Right. Good morning, everyone. I'm George Latimer, Westchester County Executive. I'm joined by Dr. Charlita Amler, who is our Commissioner for Public Health, Department of Health here in Westchester County. We also have with us in the room the Chairman of the Westchester County Board of Legislators, the Honorable Ben Boykin. He has some of his senior staff with him here, Dennis Power, Chief of Staff, and some other individuals. We have some members of our executive team from the executive branch, including our Director of Communications, Catherine Chaffee. We're going to talk about the issue at hand with measles with Dr. Amler's presence, and then after that we'll take a break. And if there are any other questions you want to ask about, you can have certainly one-on-one time with Dr. Amler on this topic. And then if there are other questions you want to ask, we'll be available to answer those questions as we go forward. We have Westchester County has learned that measles have been confirmed in 8 Westchester County children. 6 of those children are siblings, and all are from Northern Westchester. None of the children involved attend public schools or childcare programs. They are all private school students. The children range in age from 6 months to 14 years of age. The Westchester County Department of Health is working with the families and healthcare providers to identify the locations where the children may have exposed others. The children who were not vaccinated appear to have been exposed to measles by attending family events in Rockland County and in Brooklyn, where there have been ongoing outbreaks. Those are the facts as we have it now. I'm going to bring up Dr. Charlita Amler, as I mentioned, who is our Commissioner of Public Health. She has the authority in that particular position not only to advise us on the actions that her department will take to deal with this outbreak, but she also has the legal authority to proclaim any type of designation, any type of actions that might follow. It is not the authority of the general government, county executive, board of legislators to make those declarations, and I think that is as it should be. This is a matter where science triumphs over political science. This is a matter of science and medicine and what is the right thing to do to protect the public health. And I would say that we all have our individual rights guaranteed to us under the Constitution. Those personal rights, however, at some point in time cross over and impact the rights of others. And when that happens, then the public health always has to be put at the highest premium. So Dr. Amler will discuss the issues at hand. I'll close off. We'll answer any questions that you have together. And then if you'd like to interview Dr. Amler individually, we'll make sure that that's an opportunity that you have. So, Dr. Amler.
Thank you. So, good morning. And as our county executive just said, measles has been confirmed in 8 unvaccinated Westchester children. 2 of these who had to be hospitalized as a result of this infection. The children's ages ranged from 6 months to 14 years. And at this time, we are actively reaching out to work with the communities that have been impacted by these cases. The good news is that measles is preventable. There is a highly effective vaccine that works, and it's been used time and time again to stop outbreaks. And the health department is able to provide the MMR vaccine to anyone who needs it free of charge. We currently have vaccine available at our clinics in Yonkers and White Plains, and we will also be bringing MMR vaccine clinics directly to the communities that have been impacted by these cases. I really can't stress enough that vaccination is the key to stopping any measles outbreak. When people choose not to be vaccinated, measles return and outbreaks occur. There are also vulnerable populations that are unable to receive vaccine through no fault of their own, and they rely on herd immunity that routine vaccination provides to the population at large. This includes babies that are less than 1 year of age and those who have certain immunocompromising conditions that put them at risk for contracting measles when vaccination rates in the general public dip. So anyone who is unsure of his or her vaccine status should reach out to their healthcare provider or the last school that they attended. Schools maintain vaccination records for varying periods of time, but that's often a good source if you don't have your old vaccine records. If you are unable to locate your records, it's just best to get the MMR vaccine. A blood titer can be done to determine immunity to measles, but this is a luxury that we really don't have right now because that takes time. So when in doubt, my advice to the public is get a vaccine, get the MMR. It's not harmful to receive additional doses of this vaccine, and it's better to be safe than sorry. You need 2 separate doses of MMR to be fully vaccinated, and these have to be at least 28 days apart in order to be fully protective against the measles. I'd like to just go over the symptom of measles so that people understand, and that would be that symptoms usually appear from about 10 to 12 days after a person is exposed to someone who has infectious measles. The first symptoms can be a fever. That fever can be as high as 103 to 105 degrees. They get a cough. They may have a runny nose. They may have reddening of their eyes or conjunctivitis. They will eventually usually develop a rash, small red dots, and these may be raised. And eventually the dots will coalesce so that the entire person, may have they just look red. And the rash usually appears about 2 to 4 days after the fever begins and the rash can last about 5 to 6 days. The rash will usually begin on the hairline and move to the face and neck and down the hands and eventually to the arms and legs. And you may actually see the rash on the palms of the hands. A person with measles can obviously pass it to others from 4 days before the rash appears through the 4th day that they have the rash. And anyone who has signs or symptoms of measles, we would ask them please to not go directly to a healthcare facility, their doctor, an emergency room, an urgent care unannounced. Measles is airborne. It lasts in the air for hours after that person leaves the room. So we don't want people going into medical facilities and, potentially exposing others. What they should do is contact their physician or the urgent care they're going to or the emergency room that they're going to and let them know what's going on, and they can advise them how they want them to proceed. Healthcare providers who have questions can call us 24/7 at 914-813-5000. And residents who have general questions about measles can call the same number to speak to one of our staff members. And again, that number is 914-813-5000. That one.
Sure.
This one? Get it right here. 3 papers.
We'll open it up to questions in just a second. Just a couple of things. First of all, to reinforce what Dr. Amler said, that it's very important for individuals not to go to a medical facility, an urgent care facility, or a hospital unannounced. Call your physician or call the facility in advance, because the communicable nature of the disease could affect other people who are also waiting for whatever type of emergency services there are. The hospital or the emergency care facility, urgent care facility will instruct you on what you would do and how to do that in a safe and reasonable fashion. We understand that the issue of vaccination is a controversial issue for some, and there are folks that either have a religious or a otherwise philosophical objection to vaccination. As Dr. Amler said, the best way to stop the outbreak of measles from expanding is by vaccination. At this point in time, we're taking no particular steps similar to what's happened in either New York City or Rockland County, given where the outbreak of the measles has happened. But if any of those situations change, in the opinion of Dr. Amler and our medical professionals, then action will be taken. It is within her authority, and she will exercise that authority given her best medical judgment as to whether or not Westchester will restrict in any way, shape, or form the way we interact with each other as citizens. We want to err on the side of freedom of movement, but we also have to err on the side of public health. And I think it's important to note that the Department of Health has worked with the families where the measles have occurred to try to track where the motion has occurred up to this point and to try to at least identify as best as we can the scope of this. This is not, at this point, a countywide scope situation, but people in this society are mobile. And people who travel hither and yon, you don't know other people who are traveling from one place to another. You don't know when and where you might have been in contact with people. As Doctor said, this is an airborne disease. It does not require a touching scenario, so it could happen in an area where you appear and someone had been there and left before you got there, and you might still be susceptible to this happening. So the vaccination issue is important. Science tells us today that the vaccine does not cause autism. It does not cause learning disability. It protects your child. There are people who believe otherwise, but we're working off of what the scientific community and the medical community tells us, and we believe that that is an accurate and true statement. Those are allowed, those people who have religious or philosophical objections to vaccination have the right to exercise that, but they also have to understand that when we deal with something that could spread and could be injurious. She mentioned that babies under the age of 1 cannot be vaccinated. Their immunity, as she pointed out, is from herd immunity. What does that mean? Everybody else is immune, therefore it's not likely that the baby would contract the disease. But we can't, make that assumption once we see that something begins to spread. So we urge you to use prudence and do everything we can. To anticipate one of the questions, the individuals that were involved in this particular incident, the 6 members of this family and the other 2 individuals, are getting their health care treatment under HIPAA laws. We cannot release that information publicly. We apologize, but that is what we're restricted to do. The health department has ensured that they have the knowledge necessary to operate, but that is not a matter of public documentation or appreciation because of those health care privacy laws. And the outbreak at this point, I want to repeat, were with children who do not attend public schools and do not attend a child care program. So it is not a situation where we have yet seen something extend beyond the defined community where it was first identified. If we have additional information, we will update the press. Catherine Chaffee will use a number of different mechanisms. We don't anticipate having press conferences unless it warrants it. But we'll communicate with all of you by the means that we normally do if for some reason there's additional information. And again, if Dr. Amler, as she observes that information, determines that there's an action that needs to be taken, she has the authority to take it, and we will all stand behind her in that. So let me open it up for general questions for either of us, and then you'll have an opportunity to interview Dr. Amler individually if you'd like. Sean?
What communities are affected?
We understand this is in the Bedford-Mount Kisco area of the county. Northern Westchester, Bedford-Mount Kisco area. Now, I point out, everybody knows this about Westchester County, you have incorporated communities and you have zip codes that cross over incorporated communities. So we say Northern Westchester because what amounts to Mount Kisco, what amounts to Bedford can fall into the town of Newcastle and other things like that. But that's the general area where this outbreak occurred.
Can I add something to that?
Please go ahead.
But as we were saying, that really doesn't matter because, you get on a bus, you get on a train, you're on a plane, you're in a grocery store. We move around our community. No one is staying at home 24/7. So what this tells you is that you could have the opportunity to be exposed. And the way you protect yourself is by making sure that you're vaccinated. That is your best chance of not getting measles. And I can't stress that enough. The vaccine is very, very effective. It is, it's been used for many, many years, and it's good at stopping this. So if you're really concerned, get the MMR.
Tony.
I just wanted to follow up. Children under 1 year, in fact, can and are getting the MMR vaccine, correct? And what is the guidance to parents in the close proximity to the families in Northern Westchester regarding vaccinating children under 1 year?
Right. So routinely, we do not vaccinate children under 1 year of age. But you are correct in that in outbreak situations, if there is a high level of concern, children more older than 6 months of age can, in fact, get the vaccine. It will not count when we start looking, when they're ready to go to school and we're counting vaccines to say you're immunized to go to school. It won't count for that. But in some instances, people are in areas where there's a lot of measles, or they're traveling abroad into countries where there are a lot of measles. So you can give what is called a travel dose. So that's 6 months to 1 year. And then when they're a year old, it has to be repeated.
Are you making any recommendations for families in that situation at this point?
That's a decision that they need to talk about with their physician. It certainly is available to them, but I would have them have that conversation with their doctors right this moment based on, what their exposure potential is.
Jonathan?
With the springtime holiday of Passover, Easter coming up next week, how concerned, it seems like it's an isolated incident at the moment, how concerned are you with people traveling between Rockland, Westchester, Brooklyn, that this could get much bigger or out of hand?
Well, we're certainly concerned for that reason, and also because the religious observations in the various faiths will concentrate people in a shul or a church setting. So there's a great concern there. How we monitor the spread of this and whether or not it reaches a point at which the next level of action is concerned will really depend on what we see happening from these cases to whatever happens elsewhere.
And again, I mean, if people know that there's measles in the area that they're going to, they, I think, they should actually have that conversation with their doctor. And it's very, very important because we don't want this to spread. And that's why we're here today, to tell you what your risks are, to tell you what you can do to prevent yourselves from getting measles in your family. I mean, really, this is about people not getting sick. You heard 2 children were in the hospital because of this. No child should have to become ill from a disease that we can easily prevent. So we're asking for the public's help. Help us stop this disease before it is widespread. Help us.
We're going to go with John next.
Can an adult who's either had measles in the past, or not had measles, or any adult of any age, if they breathe in the measles germ, pass it along?
So measles is one of those nice diseases that if you've had it, you usually have immunity for life. And if you've been fully vaccinated, you're not likely to get it. It's a very, very effective disease. So no, you're not going to spread it to other people if you've either had the disease or you've been fully vaccinated, unless for some peculiar reason, maybe you had the vaccine and you didn't develop a full immunity. And that's when people decide to get titers. But that's rare. So I would say that's not going to happen. What we have to worry about are those people that are not vaccinated. Those are the people we have to be concerned about. Those people who've never had the disease. And if you were born before 1957, measles at that time was endemic in our population. So almost everyone born before 1957 had the measles. We don't want to go back to those days. And so, if you're born after 1957, you need to know your vaccine status. And if you haven't been vaccinated, you can't find those records, just get the vaccine again. We're happy to give it to you again for free.
For once, I'm happy to say I was born in 1953. Rebecca.
How many confirmed cases are there in Westchester, and how many vaccinations has the county given?
So we give MMR routinely through our clinics that we have in White Plains and Yonkers, and I don't know what our rate, how many we've given in the last year, but certainly we're going to be asking the state for vaccine, and so we're going to be able to vaccinate those individuals who want it. And so I don't think that will be an issue for us. As I said, we've had 8 confirmed cases. There are about 75 diseases that hospital labs and medical providers are required by law to report to us. And we have been, doing very tight surveillance since all of this happened. So as far as we are aware, and there could be people out there, I'm not saying there aren't people out there who've had the measles, who didn't go to their doctor, who didn't tell us, but I know of 8 confirmed cases.
Yes.
The 2 children who were hospitalized, are they still in the hospital at this point?
No, I believe they've both been discharged.
And were these cases all reported about the same time, or when were they reported to the county?
Well, you're actually speaking of 3, there's the 6 siblings and then 2 other people, so you're actually speaking of several groups. But as soon as I became aware that the results were final, that we had measles last night late. So this is hot off the press.
Yes. Yeah.
So you're trying to work now to retrace possible exposure. Do you now, is that something that you anticipate how long that might take, and will it be made to the public if there's
Well,
public places?
this is how we always handle communicable diseases. We interview the people who are affected, we ask them who they might have exposed, and then we reach out to those people. And that's already in the process of being done. So anyone that we're aware of who might have potentially been exposed will be notified and advised as to what they need to do. That's just, that's ongoing. That's no different between measles or any other infectious disease.
Right, but as we saw in Rockland, where they announced a supermarket or a store where there might have been a mass exposure.
And as far as I know, that is not the case here. But if it were to be the case, then absolutely yes, we would be letting you know.
Before we go back to anybody else, make sure anybody who hasn't asked a question the first time yet. Okay, so we'll go back to Tony.
Thank you, sir. Is there any specific guidance for hotels, catering halls, community rooms that might be hosting Passover events starting 9 days from now? Because you've had, unfortunately, with some of the stomach-borne viruses, issues where, restaurants and
Right, and those have more of an environmental component where we actually can go in and clean the facility. This is an airborne virus, so you breathe it in, and so there's really nothing from a cleaning point of view that those facilities can do.
from warning people and asking them to stay away under certain conditions?
Well, that's certainly up to them. I mean, that right now, this is kind of a public notice. We have it within Westchester County now. We're again asking for people's help because the only way we will stop this is if we get enough people vaccinated that we have herd immunity within our population, and that's the key.
But I think, Tony, you raised a good point. As Dr. Ambler said, as I as well, we learned of this outbreak last night. So I think it is realistic to think that we will reach out to a variety of entities to make sure they understand the information that we have and for them to take whatever appropriate actions they can take. And I would think that you've identified some of the key areas, certainly the major shopping malls, the hotels, the restaurant community. We have a very good relationship within those communities through the county government, and we'll figure out what the right message is and then how we convey it.
Right, and we're also going to be reaching out to, preschool, daycares, local physicians, emergency rooms, hospitals, everyone we can think of to remind them that, to let them know, we now have measles in Westchester. You need to be on the outlook. If you think you have a case of measles, call us, and we'll help you walk through it. So we're available. We're here to help you in any way that we can. And you all have my phone numbers, so if you need us, call us.
Yes.
You mentioned that these children are not in public schools in Westchester, correct? Are unvaccinated children allowed in public schools in Westchester?
Well, in the state of New York, you're still allowed religious exemptions. So, but we have, in the process of being prepared for this, went through our vaccination rates, and most of our schools in Westchester have really very good vaccination rates. Any schools that we have concerns with, we will work with the schools.
Are these kids who are being homeschooled? Is that why they weren't?
Well, private school settings, yeshiva settings, where they have a defined group of students within a religious entity that is where they get their education from. And just to go back to the public school situation, I'll go back to what was alluded to before about herd immunity, that if the vast majority of students in a public school setting have been immunized against the disease, and there are some for whom the religious or the philosophical exemption has occurred, they would be less likely to infect their fellow students because their fellow students would have been protected by their own vaccination. What you don't have in the public school system, and you might have in a private system, is the vast majority of students that are not immunized. That's where the jeopardy exists. Any other group questions from anyone else? Sean?
Do you have any suspected cases for which you're waiting confirmation?
Not at this time.
No, this issue has been all over the news recently, with Rockland County and the city, and parents who just want to know, should I be worried? My children attend, whatever school in Westchester, how concerned and worried should they be?
Well, I think Dr. Ambler laid out the case very clearly. If your child has been vaccinated already and has immunity, then you shouldn't be worried. You should be diligent. You should look for signs, just in case, as she pointed out, all those different symptoms. But I don't think there should be any basis for mass panic if you know that your child is immunized, and that is the reason why you should also check the immunization record to be sure. And that's true for adults as well as for young people. If your child is not immunized already, is not vaccinated, then Dr. Alma is very clear, very passionately clear about having them immunized. But you should certainly be on the lookout, because now you're in a situation where you know your child is potentially vulnerable, and that they could get that disease if they have not been immunized. If they're not going to immunize them, then they are in some jeopardy, and how much of a jeopardy will depend on where they go, who they connect with, and so forth.
Can I add one thing to that?
Please.
So, in the past, I've had people tell me I didn't vaccinate my children because these diseases are no longer in our community. There's no measles here, so why should I vaccinate? Well, hello, today we have measles. So you might want to reconsider that decision, because we have measles in our community. And if your child has not been vaccinated, they're susceptible to the disease. And if you want to protect them, again, you vaccinate them.
Excuse me, I have another question on that. Would you advise public schools, playgroups, anyone to be checking their attendees for possible symptoms?
Well, I think you would know, these kids are really sick. They get very sick. 103 fever makes you very sick. And then rash, I think if they have concerns, they should speak to the parents and let the parents know they're concerned. And the parents can then reach out to their medical providers. But I don't think they should be, doing physical exams on the children in the schools.
Yeah, and John, most of our public schools, not necessarily every single one of them, have healthcare professionals on site, generally nurses who are trained to be able to spot the symptoms of a disease, even if it takes some other level of professional to administer certain things to them. And I think this general public notice that we talked about and Charlita mentioned all the different entities, includes schools. And so now if it's the school nurse, they're on notice that there's a potential outbreak, and they're going to look for signs of it. What would normally happen is a child takes ill during the day and they're sent to the school nurse, and then immediately they can determine there's a case of measles at hand. But again, the general percentage, not universal, but the general percentage of vaccination in Westchester public schools is very high. So that's why I answered the question to this gentleman that there is no reason to be unduly alarmed and all of a sudden, take crisis action. It is important to monitor and to watch, and if a sign of measles does appear, then to take immediate action along the lines that we've described. That's in the public school setting. In a private school setting, particularly in any private school setting where we know that most of the students are not vaccinated, then the advice is to have them vaccinated, and absent that, they should be on notice that this measles outbreak can touch them. And once it comes into a setting, if there's a large number of young people that are not vaccinated, then there's a great jeopardy there. And that's the degree of concern that we express. Keep in mind there's almost 1 million people in Westchester County. We're talking about acting the morning after we both found out about something that represents X number of cases, less than 10 cases. That's how seriously we take it. We did not wait until there was 100 cases to take action. There's an immediacy, and we are influenced by what's happened in Rockland and what's happened in New York City. And I should point out, for those of you, particularly our friends who cover New York City media, in New York City, the mayor of the city of New York governs the school districts. He has the legal authority. The school system reports through the chancellor to the mayor. That does not exist in Westchester County. A county executive does not have authority over the schools. The only general government official that does is the mayor of Yonkers, and the Yonkers City School belongs to the mayor. Other than that, school districts are independent governmental entities who make their own decisions. So you should keep that in mind, particularly if you see, the mayor of New York City taking a certain action and wondering why doesn't a Westchester County executive take the same action. Secondly, as we understand the law, and to be confirmed by our county attorney, John Nona, it is not the county executive that has the authority to do these things. It is the Commissioner of Health to do that. And then, of course, there's higher authorities above this, where this to come to some higher degree of action, a state or a federal government certainly could step in and take on superior authority if they chose to do so.
As the county executive, how concerned are you about this?
I'm concerned, but I'm not at a point of crisis mobilization. We're dealing with something that we've learned about. We learned about it last night. We want it to be open and transparent to the press today. As you can see, my phone never stops ringing, so people are reaching out. And I think by having this press availability this morning, we're showing you that we're trying to stay on top of this and stay ahead of the curve. But obviously, as I said earlier, I don't know if this is the quotable line of the press conference or not, science takes precedence over political science. So the things that we have as a debate in the society have to stop when we deal with something that could be a scientific medical crisis. And so that's why with a very capable medical professional who has had not just our county health department, but previously headed another county's health department. She is knowledgeable and she has a very capable team. Some of the people are in this room today. We look to them to give us the scientific medical advice on what best to do so that our decisions will be based on that rather than on what comes, from a normal political debate of, pro and con in the society.
If I can follow up.
Yeah, please.
What do you say to people who just don't trust these vaccines and say, I'm not going to vaccinate my kid?
Well, look, you have the right to make the decision you want to. You're a free American, and in this country, you have a constitutional right, if you have religious objection, not to exercise that. Whether you exercise your authority or right is wise or unwise is not for me to say, except to say that we have had vaccination in this country on a host of different things. I made the joke about being born in 1953. I'm in that zone of Americans that started with polio vaccines and a host of other vaccines. To the greatest extent, we have maintained the most consistent public health throughout the course of these 65 years that I've been on this planet. There are always cases that fall outside of the norm, but no one can deny the success of vaccination in wiping out diseases to the point where people don't see them in the society at all. And in the period of time, right at the time I was born and prior to that, these diseases were prevalent everywhere. So a person has to make an individual decision. But at that point, where the personal right to make those decisions bump into the public health, and it's clear that we have a clear and present public health danger. When 6 cases become significantly more than that, then we will use the authority of government. We will use it prudently, we will use it with restraint, but we will use it to protect the public health of Westchester people. We are not at that point today, but if we get to that point, we'll certainly tell you and tell you why we're doing whatever it is we decide to do if this morphs out into something much greater.
So what are you contemplating?
We're contemplating nothing other than monitoring this and determining where it takes it. If it's controllable within a relatively small universe, then the steps that the commissioner has outlined will be effective and will get us through this moment. If this thing were to morph beyond that, then there are other options available to us and we'll pursue them. But why speculate? Because it only adds to the concern that people have that may be disproportionate to the level of the concern today. We want to be accurate and we want to be appropriate for where we are today. But as I've said, if tomorrow we find out significantly different news, we'll invite you back in and talk about where we go there. Any other questions? If not, I know Dr. Amler and her team have to get back to work, but I do want to let any of the media outlets have a one-on-one with her if they'd like to do that, because she's the professional on this. And then if there are any other questions you'd like to ask me, I'll stick around for a minute or two and we can do that. Dr. Amler, thank you for your fine professional work.
Thank you. I appreciate it.